Alrighty, so today we'll be performing ostomy care on a patient. Before I go in, I will verify my doctor's orders and make sure I gather all of my equipment. So we'll go ahead and go in the patient's room. Alrighty, so if you'll verify your name and date of birth for me. Alright, so it's the correct patient. And I'll go ahead and we will imagine that the patient has an ostomy bag on right now. I will start by emptying the ostomy bag, and I will open it up at the bottom, take the clip off if it's a clip, or sometimes it has more like a Velcro. But I'll go ahead and open that up, empty it out, and I'll look at the color and the consistency of the stool. I'll put that to the side. I've got my biohazard bag, and I'll put out. So just imagine that this is put out to the side. So I'll go ahead and close it back up and start removing the old ostomy bag. So I'll make sure I'm holding the skin taut, making sure that I'm not messing with the integrity of the patient's skin or around their stoma. So once I have it, I'm gonna put it in the biohazard bag. I'm gonna look at the stoma. It is red, so it is getting plenty of circulation to it. I'm gonna go ahead and place a towel there to make sure that we don't get any stool on the patient's skin. We don't want any skin breakdown. Go ahead and measure the stoma. Make sure I'm getting the right size. And get my colostomy bag out and everything. Piece of remover. We've got our protective barrier. Piece of remover. Alrighty, and then we'll put warm water in here, and that way we can clean around the stoma. So I'll go ahead and grab an adhesive remover and clean around it, making sure that I'm taking off any adhesive that was on in there from the colostomy the patient had. So I'll make sure all of that is cleaned off. And I'll go ahead and clean it with the warm water and the mild soap. Clean it. Go ahead and put over here. And now that I've measured the stoma, I'll make sure that I cut it to the right size. I want to make sure that when I cut it, I want to make it the correct size, because if it's too big, the stool can get around the skin around the stoma and then cause skin breakdown. Or if it's too small, I could possibly stop that circulation to the stoma and cause complications to the patient. So we'll say that there's adhesive on the back of this, but I'll go ahead, once I have it correctly sized, I will put the protective barrier, and it has kind of like an adhesive to it. So we'll do that. And then we'll stick it to the patient. Put it on the patient. And I will have the little clip at the bottom, make sure that it's sealed properly, and make sure that I'm going around the stoma and making sure that it does close around it. Alrighty, make sure that I'm cleaning it. And we'll go ahead and put everything in the biohazard bag that needs to go in the biohazard bag. Dump our stool out. Alrighty. Alright. If you need anything, you let us know. Throw this in the trash can biohazard bag. get rid of everything. All right, let us know if you need anything. We'll come back and check on you. So once I finish the patient's ostomy care, I will go document the procedure, that the stoma appeared beefy red, it's getting proper circulation, making sure that I measured the size of the stoma, and the patient did tolerate well. We'll go ahead and document the stool consistency, and I'll continue to assess the patient and change the colostomy bag as needed.